Hello, it's Bill, the Knee Pain Guru. Today is Thursday, June 2nd, 2022. Excuse me. We're going to dig into some questions here. Before we dig into that, make sure to give the video a thumbs up, like, and subscribe to the channel, the Knee Pain Guru YouTube channel. Turn on notifications for future videos. Let me see here. Okay, there is information if you would like to go a little deeper based on the information you're hearing today. Okay, we're going to look at steroid injections. Talk about steroid injections in the knee. The question is from Lynette Prieto. It's 3 years since I did a total knee replacement and I'm still experiencing limited range of motion, not much pain, still having problems navigating the stairs. The problem is on the lateral side of the knee. It feels very tight when I'm trying to bend the knee. Please help me. I've been to the doctor several times, but each time I go, I'm given a steroid injection in the knee. How long should I be taking these injections? How long you should be taking the injections is going to be a conversation between you and your doctor. Definitely have a look at the effects that steroids have on the body. Well, we could do that right now. Injections have on the knee. So that's what we're doing right now. We're going to do a quick search that says steroid injections in the knee and the hip. Okay, here are the side effects of knee injections. Okay, I'm going to share the screen here. We're going to dig into this. If you have questions about what's going on with your knee, please enter those in the comments section. I will dig into those as we progress through the call today. So here we go. So here's side effects. This is on verywellhealth.com, knee injection side effects. There's a flare reaction. Discomfort at the injection site may cause an increase in pain for 24 to 48 hours after the injection. Icing the injection site may help with this temporary flare of pain. Elevated blood sugar levels. Speak to your healthcare provider if you have diabetes before receiving a cortisone injection, as steroids can cause blood glucose or sugar levels to rise. Loss of fatty tissue. High doses of cortisone can lead to dimpling of the skin or thinning of fat in the area. Skin pigment changes. A loss of pigmentation may be noted and can be permanent. And then says when used on a long-term basis, the high use of cortisone in the cortisone injections for the knee may break down tissue such as tendons, ligaments, and cartilage in the knee joint. But you have had, and this is something for to take into consideration. Hold on a second. Lynette, being that she's had a knee replacement surgery and the essentially the joint has been cut off and replaced with plastic and metal, there is no longer tendons, ligaments, and the cartilage right there in the knee joint. So that doesn't seem to be as much of an issue. However, you have tendons, ligaments, and cartilage and meniscus and other areas of your body. So that's something to take into consideration when you look at getting cortisone injections over and over again as the result, or at like the default to get the injections to help your knee out of pain. I think if we zoom out, we can potentially use it as a short-term strategy, but at the same time, we want to look at a long-term strategy for the health and well-being of your knee, your body, and what you really want to do. And this is a term that I bring into conversations with clients, members of my knee club program, is what I refer to as medical sovereignty. And that's you have the choice as to what you want to happen with your knee. There is an article that is brewing, and it's talking about the understanding that when we look at alternative or holistic approaches, many times, and I did this, I was guilty of this in the beginning, that we want to do the Western medical model because we don't want to leave anything out, and we want to do this other stuff, this alternative, this natural approach. And what ends up happening is many times we're kind of straddling the fence in the process of knowing what to do. So we want to do all of it, and then it ends up costing a lot of money, and we don't necessarily know what results we're looking for or what to expect, because the mentality working in the conventional medical model or working with that conventional approach is very, very different than a holistic approach. And there is a lot of mindset and belief that needs to be changed in order for us to be able to embrace an alternative or holistic approach, that there's things we're actually working against if we're doing both approaches at the same time. It's important we understand how to weave those two approaches together, an integrated approach, you may hear at times. That's my rooster. But the point of it is, we want to begin to understand, like when I think of Lynette's knee, I immediately go to the fibula, which is the springy bone on the outside of the lower part of the leg. And sometimes that can get tweaked or twisted, or there's a certain degree of misalignment that takes place as a result of the trauma from limping for an extended period of time that led to a arthritic and a bone-on-bone situation, and eventually a knee replacement surgery. That even though the knee replacement surgery took place, there's still that tension pattern that's going on in the fibula that is causing the tightness and the discomfort that Lynette is experiencing. Rooster seems to know when I lift my window up. Anyhow, if you have questions, please type those in the comments section. If you like the information, give the video a thumbs up. Like and subscribe to the Knee Pain Guru YouTube channel, as well as turn on notifications for future videos as I address questions like this that really tie in to help you understand, bring more an awareness around what's going on with knee pain, getting a different approach. And that is the biggest hurdle I see many people suffering for an extended period of time with their knees, is they're looking at trying a new approach through an old lens. Anyhow, okay, let me get over here to, and by the way, Lynette, I could totally help you with what you have going on. And that's a big thing. I have the program, Knee Club. That is a group coaching program. The information is scrolling right along the bottom of the screen here. You could shoot me a text or give us a call on toll-free number. And you can also get a teaser, which is the most recent Knee Club training that I did. You can get the last one. You can see what that is, and see my approach, see how I work with the members and how we work to get them out of pain. And the approach to get out of pain is actually quite simple. It's when the mind, the emotions, and wanting to get out of pain kind of gets in the way of seeing clearly as to what the body needs in order to get out of pain the fastest. Okay, Sharon sent this. Sharon says prolotherapy. Prolotherapy, for those that aren't familiar, do a get a what is prolotherapy. And I've experienced prolotherapy as well, and it's usually some type of sugar water solution that will be injected at the site of a pain, injury, usually when it doesn't heal after an extended period of time. And that irritation with the needle being injected in that area will cause localized inflammation, specifically at that point. There is a good friend of mine is an osteopath. They incorporate that quite a bit in their practice. And prolotherapy, here, we'll read this right here. Let me share the screen. Dig into prolotherapy. Here we go. Prolotherapy. Prolotherapy, proliferative therapy, is known as a non-surgical ligament and tendon reconstruction and regenerative joint injection. It is a recognized orthopedic procedure that stimulates the body's healing processes to strengthen and repair injured and painful joints and connective tissue. It is based on the fact that when ligaments or tendons are stretched or torn, the joint they are holding destabilizes and become painful. Prolotherapy, with its unique ability to directly address the cause of the instability, can repair the weakened sites and produce new collagen tissue, resulting in permanent stabilization of the joint. Once the joint is stabilized, pain usually resolves. Traditional approaches with surgery have more risk and may fail to stabilize the joint and relieve pain, and anti-inflammatory and other pain relievers only act temporarily. And this is what they would be referring to with the cortisone injections. The original term used for this therapy was sclerotherapy, coined in the 1930s when this treatment was discovered and included both joint and vein injections. Today, the term prolotherapy is used for joint, ligament, and tendon injections, while sclerotherapy is used for the treatment of varicose veins, spider veins, hemorrhoids, and other vascular abnormalities. So that gives you an idea of what Sharon was throwing out there as a possible alternative. If we go back to Lynette's initial thing, limited range of motion and not much pain, still having problems. So the pain isn't so much of the issue, it's a range of motion. And the range of motion could be a result, or lack of range of motion could be a result of the joint being too tight. And this is what happens when the neurology responds to the pain, the trauma that Lynette's knee has been through, and that tenses up to protect. That's what the body does when it feels pain. There's a threat to the body. It tenses up to protect itself, which can reduce the amount of space in the joint, limiting the range of motion. So the more we can address the tension pattern, like I was saying in the fibula, as well as the hips and lower back, because in order for the full range of motion in the knee to happen, we have to have the hips and the lower back freed up as well. And many times when the knee has been in pain for an extended period of time, the hips and lower back tighten up to protect the knee because it doesn't want to feel the pain. And the tension in the hips and lower back limit the range of motion in the knee. So we need to, once again, we need to zoom out, look at a holistic approach. And the cortisone injections that Lynette's been receiving from her doctor, once again, she needs to check with her doctor first. However, that doesn't seem to be a solution that's working that well for her. So she may want to look at something else. Prolotherapy doesn't sound like it would be a complete fit based on what Sharon is throwing out there. However, looking at relaxing the tension patterns and the neurology, I found to be very, very effective and very valuable in terms of increasing the range of motion in the knee joint as well as reducing the pain. So, if you have questions, please type those in the comments section. I'm going to play a short video for you. You can check out here. If you want more information, you can go down in the description box. There's a link there for the different ways I can provide support for you and your knee remotely online. So you can check that out in the description box, or you can head on over to the Knee Pain Guru website or give us a call or text. Okay, here's the video. If you do have questions, type those in the comments section, and I'll pop back in about a minute, and I'll answer those questions for you. Okay, we are back. It's Bill the Knee Pain Guru. I don't see any questions that came in. So we're going to wrap it up for today. If you're watching the replay and you would like to share your questions or comments, please type those in the comments section. This will be on a number of different platforms, but you can check it out in all of those different places. So, this is Bill Paravano, the Knee Pain Guru. Thank you so much for being here. Have a wonderful day, and I will see you on the next one.